Hello, YouTube peoples. How you guys doing? Hey, so I started this vlog. I guess this is episode 2, and again, no talking points, no script. I'm just winging it here. So I had a follow-up appointment today with orthopedic surgeon. They reviewed the MRI images again, and they brought in like a second opinion just to take a look at me. And the MRI, the imaging shows an ACL tear, or they can't see the ACL, so the radiologist, I guess, reported that it's torn. The physician kind of can agree. There's some physiological, there's an ambulance going by, so apologize if it's noisy. There's I forget what the term they use, but basically I have a bad bone bruise, which is one of the telltale signs of an ACL rupture. But when they do the physical examination on my knee's tight. It's kind of, they're hit, when they do that classic test to see if your knee kind of doesn't give or give, it's not giving like when an ACL is torn. So they feel what he called it, like that a wall. And both knees are very, very similar as far as, the amount of movement that I have in them. So for right now, we could potentially say there's no torn ACL, which would kind of defeat the purpose of making more videos. So I think what we'll do is I'll just keep on making some videos to see how my healing's going with the plateau fracture, and we'll see if maybe hopefully we continue on a good trend as far as not needing to have any type of surgical procedure done. That's the surgeon's kind of doesn't think there's a need for that right now. Just wants to do some therapy, continue with physical therapy. And he actually, based on my range of motion, told me that I could spin on my bicycle with no resistance, or as tolerated, pain tolerated. Use like a red light kind of method of whether I should continue doing what I'm doing or not, right? Yellow, if you feel some discomfort but it subsides, it's the yellow light. Use that as kind of like caution and continue to do that. But if I have pain that does not go away once I stop the activity, that is an obvious red light. Don't do that. So we'll see what happens in the next few weeks. This is probably a short video. I don't think I'm gonna even make it to 5 minutes. I am driving, but yeah, I guess really good news. I am happy with this news. So when I went to the doctor on Monday, when I made the first video, the physician, said, yeah, ACL tear based on the imaging, but he, did the physical exam, and he's like, I don't know if I agree. Went back and looked at the images again. He's like, no, it looks like it's torn. So like, for that moment where, you're like going in there expecting bad news, and then the doctor touches you and he's like, no, everything looks fine, I don't agree with that. But then they go back. It's like this kind of like a little bit of like this emotional roller coaster, right? So, you get real happy, and then you're like, oh yes, I don't have to, my recovery is not going to be that bad, right? And then you get the bad news and your heart kind of sinks a little bit, and you're like, dag on it, not what I wanted to hear. But going in with the bad news on my mind, thinking that, hey, we're going to let this bone continue to heal and look at surgery, and talking about surgical options today, whether we do a graft from myself or get a donor ligament. Didn't have to have that talk. So end of the day, I think good news. We'll continue to provide some updates as we progress along, and I guess for now, until next week, I'll post something next week, and kind of just showing where I'm at, what I'm able to do or not do. I'll kind of maybe talk a little bit about like what physical therapy has me doing on my own and in the office. And next appointment with the ortho is 4 weeks from today. So so for right now, just we'll see how things go week by week. All right, have a good one. Bye.